Welcome, everyone. It's been surprisingly, it has went very quickly. I've sat where you've been sitting, and it goes very fast. At least it did for me. I can't believe this is the end. So I did my capstone project, my applied project on addressing cardiovascular education for the medical surgical nurses for the adult population. And the rationale of that is healthy people, 2020, state 1 in 3 adults have one form or more of cardiovascular disease. That's about 81.1 million people. It's the #1 cause of death in both men and women. So it is essential that nurses are able to recognize early signs and symptoms, diagnostic treatments, and treatments for cardiovascular disease to improve patient outcomes. The hospital I created this class at currently did not have anything for the med-surg nurses. What they used to have is critical care classes, and those were cardiac, neuro, pulmonary, renal, and hemodynamics. The educators of critical care found an online course, and you know, a lot of people are going to online things. And when they found this program, they took away all the classes that med-surg nurses could have taken if they wanted to, but they took them away. Now, ECHO, which is Essentials of Critical Care of Orientation, costs $225 a person. And they paid that for the critical care nurses. But if the med-surg nurse wanted to take it, it would cost $225, even though they just wanted one module, maybe two. Maybe they wanted cardiac and pulmonary. They couldn't do it because it wasn't cost effective. So there was nothing out there to help them get the information they needed. I sent out a questionnaire to about 350 med-surg nurses that take care of adult population and asked them, do you feel comfortable in taking care of cardiovascular patients? Would you benefit from a cardiac class? And then I listed all the cardiac disease processes and said, could you rate what ones you would like to learn about? And the results I got was 80% of them said no. They didn't feel comfortable taking care of cardiovascular patients. Yes, they would benefit from a med-surg cardiac class, and then they listed, and I'll show you in my content later on, what classes or what disease processes they wanted to learn about. At this hospital, there is a rapid response team. One of their complaints was, I shouldn't say complaints, but one of their concerns was a lot of calls they were getting to go assess patients could have been avoided had the staff been able to recognize early enough the signs and symptoms of heart failure or an MI or something like that. Instead, they waited too long and the patient got into trouble. So we really felt with all that information it would be imperative to provide a med-surg cardiac class. It is essential that nurses are given that knowledge base that they need to take care of their patients, to help with patient outcome, to decrease mortality and morbidity rates. My purpose for this class was to give them that evidence-based practice for how to care for a cardiac patient. That changes quite frequently. You know, I'm just going to real quickly say one thing that's changed that was a huge change is we don't necessarily have to do the oxygen anymore. We were all taught that MONA and that morphine oxygen. Well, oxygen they've learned doesn't really do anything. We still do it, but that is a change in national guidelines. My sole purpose of this course was so that those med-surg nurses could go back to their unit, apply what they learned, and increase patient outcomes, decrease mortality and morbidity, and decrease the amount of calls that go to rapid response, because now they were on top of being able to assess their patients. The relevance, well, when I started this literature search, I had some difficulties because I wasn't quite sure how to do that. So I started off with putting in med-surg class increases, med-surg cardiac class increases patient outcomes or something like that, and nothing came up. And I thought about it, and I thought about it, and I finally thought, just put in what you're going to teach. So that's what I did, and I've got several articles on all the areas that was going to be in this class. Spoke on the relevance and the importance of med-surg nurses having the knowledge to take care of those cardiovascular patients. So it shows you up there, I found 6 articles on acute coronary syndrome, 7 articles on heart failure and thus my criteria search was from 2007 to 2012. I wanted a full text, and I wanted it in English. So I did all that. And then I also wanted to make it interactive, because in my research of presenting, I saw that you need to keep people engaged, you need to keep moving forward, and you need to keep it relevant. So I wanted to find new ways to keep it engaging. And what we have at the hospital I did this at is a turning point system, which is a clicker system, audience response system, that you could put slides in and they could be engaged with answering the questions. So I did the research on that article also and found some wonderful literature reviews that proved not necessarily that test scores improved, but that the participants felt they did learn more because it was so interactive. The outcomes I did, of course, you all know Bloom's taxonomy, and I did my outcomes based off these. There's the cognitive, the psychomotor, and the affective, and you have the levels from simple to complex. In this class, I figured I would have novice mostly because they're med-surg nurses, and yes, where they work, they might not be novice, but they'd be novice to cardiovascular disease. So when I made my objectives, I based it off novice to a little bit, or the simple to a little bit upper levels. I forgot to make a backup copy of my brain, so everything I learned last semester was lost. And the reason why I put this in was twofold. One, people have gotten used to technology, so they rely heavily on technology. And let me tell you a lesson I learned this year. Make sure you make backups of backups, because I lost all my information because I dropped my hard drive, my external hard drive, and although it didn't look like it broke, and I lost everything. But if I would have backed up that, I had a few little backups, but not a backup of my whole backup, so just learn that lesson. And the other thing is with the taxonomy levels, if you just give them the knowledge base, which is they just can recite, they can recognize, they can recall, that's just learning what they have to do to maybe pass a test. If you keep them at that learning level, they're not going to remember. So you want to keep making sure you go up those levels and help them to get up to the evaluation level. So here's some examples. This was a 7.5-hour class, and so I had a lot of objectives. So I just put some examples here so you could see under each level what I did. So for the cognitive, I started off with a very simple knowledge. Upon completion of this course, the nurse will recognize common causes or risk factors of acute coronary syndrome. Went up to comprehension, and I wanted them to be able to explain pathophysiology of acute coronary syndrome or the rupture of the plaque. The application, this showed that they were able to apply what they learned by saying, okay, I've got these signs and symptoms. Now these are the diagnostic tests I will know I have to obtain. So they will write those out. And then analysis, and that's distinguishing between the four the four heart failure classes. Psychomotor was a little bit harder for me to come up with, because all I was sitting there thinking is I'm not going to have them actually do assessments in the class. But I am going to teach them how to do that assessment, and I'm going to give them that information. So I wanted them to be able to go back and apply those assessment skills when they got back to their units. And that was being able to assess those signs and symptoms for heart failure. And then affective, I wanted them to value teaching their acute coronary syndrome patient about the risk factors, because what we have seen on cardiology is that the patient comes in, we open their vessel back up, we put a stent in, and they go home and they go right back to smoking, eating McDonald's, fast fooding it, and they're back in 6 months. But if we take the time to educate them, then we will have them hopefully decrease those risk factors and not be back as quickly. The audience, of course, is adults, and yes, adults can learn. They just learn differently. I used Knoll's adult learning theories, and there's 6 assumptions. And kids learn by content, so they take social studies, they take math, but adults learn by problem-centered, when it's a problem for them. I just had one of the OB nurses call me because her husband was having some arrhythmia problems, and now she's interested in knowing about arrhythmias. So that's how adults learn. They're more into it when they have to know about it. We bring life experiences to the table. So you really, when you're teaching a class, and what I did at the beginning of this class was ask, has anybody ever taken care of a patient with cardiovascular issues? I had 6 novice nurses, and they all said no. We only had taught or learned the stuff in school. But you could have somebody that could bring that set with them and tell everybody in the class how it went, maybe what they would have done better, differently, or what they did really good and that they picked up on. There's going to be novice to expert nurses in this class because it's going to be open to any med-surg nurse in the hospital. I apologize that this is a little fuzzy, but it really drove home what I was trying to make with the factors. To ensure a fair selection, you all get the same test. You all must climb that tree. And you can see that every animal there is different. And there's no way some of them are going to climb that tree. But my point here was everybody's different, and everybody has learning styles. So when you're creating a class, and when I created this class, I had to think about all those things. How people learn differently. Some learn better by reading, some learn better by writing, some actually learn better by watching. So you have to think of all those things. You have to realize there's different cultures. There's people with different degrees. Some might be an associate's, others might have a master's. All those things have to be taken into consideration when I was developing this class. The content and methodology. The content I used, as I said, was through my lit research, but also through what those nurses told me they wanted to learn about. And these were the top things they said. Acute coronary syndrome, heart failure, what a patient went through at the cath lab, the metabolic syndrome, and although med-surg nurses won't have anything to do with an intra-aortic balloon pump, they could possibly take care of a patient that has had one. So they wanted to know what could happen after the balloon pump's taken off. And then the pacemaker and pharmacy was the medications. My methodology, I used PowerPoint. But as I told you, I also used Turning Point, which is the clicker right down there and here. Every participant was given that clicker, and that helped them answer the questions. So here's an example of an interactive slide that I put in there with a question. And I can't make it work here because I don't have Turning Point here. But as once that comes up, I'll push a button and a counter right here would start. This actually, once I had that going, it would start counting down. Up here, in this corner up here, would actually show how many participants have actually answered that question. So if you know you had 25 people, you're looking for 25. So if the counter wasn't at 0 yet, and all 25 had responded, you can go ahead and just push your button and your slide will come up that will show you the percent of what each person answered, how many answered question 1, how many answered question 2. And the nice thing about that is it not only kept them interactive, but it made me teach a little differently. I taught based off their answers instead of teaching what I wanted to teach. I taught what I was seeing they needed to learn. So it helps you to change and teach truly what they might not understand, as opposed to just simply talking to them. You're helping them. This is immediate feedback to the instructor, helps them to know immediately what might need to be taught and what they're not understanding correctly. So it was really a nice addition. Then I threw in some illustrations to help break it up. In my research, I saw every 20 minutes, probably even sooner, because I did read in one book where within 30 seconds you lose an adult if you don't keep everything going. So their full attention, you know, their mind will start wandering and all that. So I tried to keep interchanging things, and I put in YouTube videos, and I'm just going to show this real quick. I'm going to play the whole thing if I can get it to come up.
Percutaneous coronary intervention, also known as coronary angioplasty, opens narrowed coronary arteries. A small hollow tube called a catheter is a
So that just gives you a quick view. I also had those videos. You have to be careful. YouTube is wonderful for teaching, but you have to be very careful what you use, because some of it's not real accurate and some of it's inappropriate. But they have wonderful teaching things out there if you find them. So I put some YouTube videos in my presentations. I made a pre and a post test for me to be able to see that learning did occur after my class was finished. I had case scenarios in there. I put the case scenarios after each section, and they were I felt, because of the audience response system, it kept them interacting, that once the case scenarios got there, they were really spewing everything off and saying, yeah, we should do this next. Oh no, they shouldn't have done that. And it was a wonderful thing to see. I also wanted them to not just solely rely on everything they learned that day, because it's a 7.5-hour class. And so I made them resource things to take with them, so when they're out on their units, they would have something in their pocket to pull out and say, now what was this for? So I made pocket cards of medications, of frequent use cardiac medications. I put them under like beta blockers, calcium channel blockers, and then put what their actions were and why specifically they were used on heart patients, because you know a lot of those are also given for hypertension and that sort of thing. But I put why specifically they might see that on their heart patient. Then I gave them a little card that if they went and did an EKG on somebody, they could say, well, I look in this lead, this lead, and this lead, and this must be where the MI is happening, with what complications they should look for. So they would have those resources with them once they walked away from the class. And I created a syllabus for the people if they weren't sure, I don't know if I want that class or not, or if that's really going to meet my needs. I went through the description, I put all my objectives in there, put how to enroll, the times of the class, the instructors of the class, all that information was in that syllabus to help them to decide, yep, that's the class I want to take. This is an example of a handout I made. Unfortunately, we were running late, so I did not get to utilize this in the class, which I thought I was going to. So I did offer them the answer key so they could do it later if they wanted. But it's a heart failure puzzle, and it just went through some of the heart failure information. Implementation. With implementation, when I thought about this class, I thought it would be good to have different instructors. I don't think anybody would want to sit and listen to me for 7.5 hours, so I wanted to break that up a little bit. So I decided I chose 2 sections I would teach, and then I asked other instructors if they would be willing to do this. And everyone was very excited about it and said yes. So we met several times. They would create their own presentations, and we would meet and make sure that they were done the way that we wanted it to be done. I had to set up the room, make sure the room was a good size, determine the order of the presentation, which unfortunately that day I had to change it because the cath lab had an emergency, so we had to change that around. At the start of the class, I just did the welcome screen. I gave them a pre and a post test. The post test later, the pre-test first, and the pre-test went a little bit longer, so I had to adjust that a little bit, and then gave them their lunch breaks, made them copies of the CEUs. I did get CEUs. They got 6.5 CEUs for coming to this class, and then I provided them with the evaluations. The class was held in February of 2012, and I had 6 nurses attend. The evaluation. To do this class, I did the ADDIE, the Analysis, Design, Develop, Implement, and Evaluate. And then, so now I'm to the evaluation. The formative evaluation was the adult response system, and that was immediate feedback that I received and knew how to teach. I also got feedback by having the case studies. I could see they were interacting and giving me the correct answers, so I knew that they had learned what I wanted them to learn. The summative evaluations, the CEU objectives, you have to have an evaluation to get CEUs, and that simply just says you have all your objectives listed, and it says yes or no. Were they met or weren't they met? And if you say no, then there's a spot to say why they weren't met, and everybody in the class circled yeses, which either most people will just circle the whole thing or they'll do them individual. But the whole class did circle yeses and did state several comments were left on how much they enjoyed the clicker system. Here's the pre and post test. Here's the difference. You can see that everybody that took, I used initials because of course I couldn't use their names, but everybody that was in the class improved in their post-test scores. And what I learned. So what I learned from all this, first of all, was several things, but the biggest thing I learned is, remember my purpose? My purpose was to change their behavior when they went back to their units so that they would take care of the cardiovascular patients and increase patient outcomes, decrease mortality, morbidity. I didn't have anything in place to evaluate that. I forgot about that piece, so I had stuff to evaluate the class. Did they like the class? Did they learn a little bit the class? But not to change their behavior. So what I have done is developed for the next class. I have 2 more classes. One's August 22nd coming up, and then one in November. What I've done for that class is I created a Kirkpatrick evaluation, a level 3, which is a change of behavior. Kirkpatrick has 4 levels. I'm doing the level 3, which is saying we're changing their behavior. And you send it out 2 to 3 months after you've provided the class. So in 2 to 3 months, once I give them time to change that behavior, I will send this out and see, did you take care of a cardiovascular patient? If so, did what you learned in class help you with taking care of that cardiovascular patient? So I can know if what I taught actually reached out to the units. And the other thing, I did leave some objectives out on the pre and post test, so I need to change that around a little bit. So, and then the cath lab presenter realized he ran out of time too, so he has to do some changes. So, like I said, the biggest lesson I learned, I had never created a class from the bottom up before, and there were so many things that had to be involved. I forgot the most I felt the most important was realizing, knowing if I made that impact I wanted to out there on those units, the med-surg units of taking care of those cardiovascular patients. Thank you, and any questions?